So in this video, we're going to talk about rectal examination. And this is a little less easy to demonstrate because you won't be able to see what we would be doing on the inside. So I'm mostly going to show you with my hands how we position things. Just like abdominal palpation, like most things on a physical examination, if you're doing it well, it shouldn't be painful. And it's maybe a little bit unusual for the animal, a little bit off-putting, but it should not hurt unless the animal has pathology in that area. And so the key is going slowly. The tendency is to want to get it done, get it over with, but if you go quickly, it's more uncomfortable for the patient. The other thing regarding comfort for the patient is remembering not to jack their tail too high. For many animals, it's really only comfortable to pull their tail to about halfway up. And when people jack it all the way up, they're much more likely to react negatively and be uncomfortable. And so you want to have a well lubricated, you want to wear a glove, well lubricated, and when you, so you're going to start with your finger at the orifice and just put gentle pressure on the anus, and just like every other muscle, it will fatigue if you just stay and press and hold there. Once the muscle relaxes to the point where you can get your finger through the anus, my recommendation is to push your finger downward immediately. So go down directly onto the ventral floor of the rectum or the pelvic canal. And the reason for that is if you go straight in and you get feces on the glove, then you're going to lose the ability to palpate one of the levels that you're supposed to palpate when doing a rectal examination. You need to feel the mucosal surface, you need to feel the wall of the rectum all the way around, and you need to feel the extramural structures. And if you get feces on the tip of your finger, then you're not able to adequately palpate the mucosal surface. The mucosal surface of the rectum is perfectly smooth. If it feels irregular, if it's lumpy or bumpy, that's abnormal. So you might feel sort of a cobblestone type feeling, or like a Berber carpet, if the dog has rectal lymphoma or ulcerative colitis or histoplasmosis. And so it's going to feel, that mucosa is going to feel irregular when you slide your finger along the mucosa in each direction. Polyps may actually, they're luminal structures. They actually stick into the lumen. And so if there's actually something hanging down, you can flip it back and forth as you palpate. And so you can tell that the structure is actually pedunculated. And so that's the superficial palpation. You also need to push more with greater pressure to feel the wall structures and the extramural structures within the pelvic canal. So we typically start, again, just as you go in, you're going to go ventrally to avoid getting stool on your glove, and then you're going to slide your finger forward. And on the ventral aspect of the pelvic canal, you're going to feel the urethra. If there were a vaginal tumor in a female, you might feel a bump there. The wall of the horizontal portion of the vagina is very flaccid and soft, so you don't really discern it as a separate structure unless it's abnormal. So you're going to slide your finger ventrally as far as it will go. And in an animal, like for a male, as I'm doing my rectal examination, I'm going to hold onto the urinary bladder and actually push the bladder into the pelvic inlet so that I can get my finger in far enough to be able to feel the caudal aspect of the prostate gland. So you're actually palpating with sort of two hands at the same time. And again, if you're doing it well, it should not be uncomfortable for the animal. So you're going to push your fingers as far forward as you can to feel the prostate. And the normal prostate is bilobed, so there's a median raphe, and it's a little bit of a dent in the middle. It's compliant. When you press on it, it gives. So if it's irregular or if it is hard, if it's enlarged, those are all things that you're feeling for in the prostate. On a female, you can do the same thing, pushing the bladder into the pelvic inlet. And if they happen to have a tumor in the trigone of the bladder, you can sometimes palpate them if the dog is not too large. So small animals, you might be able to do that. It feels harder instead of the normal compliant trigone region of the urinary bladder. So you push it into the pelvic inlet and palpate. One of the things that I think is unfortunately missed sometimes is the recognition that when you are pushing in on the anus, it moves. There's no bone behind it, and so when you're starting to fatigue that muscle, the entire anus will move forward. In some animals, it can be several centimeters, even 5 or 6 centimeters on a large dog, like a German Shepherd dog. And so as that muscle is resisting your finger, you're pushing on it, you're moving the whole anus forward, and then you push your finger through and go downward to feel that urethra. If you only go forward, you're essentially missing the caudal third of the pelvic urethra. So you need to remember to pull your finger back and continue to palpate the urethra until you fall off the caudal aspect of the pubic bone. The caudal aspect of the pubic bone is important because that's a place where stones may lodge, so you need to know what that feels like in normal animals. And also, of course, if you're missing a third of the urethra, you're going to miss tumors in the urethra, near the papilla, for instance, in females. And so what happens is that people push forward, go down, go forward, and they forget the whole caudal third or half of the pelvic urethra. So don't forget that. Pull all the way backwards before you move on to other parts of the pelvic canal. So when you're feeling, for instance, the mucosa all the way around that circumference, you need to remember where your blind spot is. I'm left-handed, so for me, I can only push my elbow so far, and so from about 10 o'clock to midnight, I can't get my finger there very easily, unless I actually change my position to turn my elbow over, or if you happen to be flexible, you might be able to go all the way this way. And so just be cognizant. Right-handed people have a blind spot between midnight and 2 o'clock, and left-handed people tend to have a blind spot between 10 o'clock and midnight. And so remember that when you're trying to palpate the mucosa, well, all of the structures, so that you don't miss that percentage of the pelvic canal as you're going all the way around. It's got to be a 360-degree palpation. If you're trying to discern if a structure is actually mural or extramural, remember that the rectum itself moves. You can move it a long distance within the pelvic canal. It's not tethered except at the anus, and so it can slide back and forth. So if you had a mass or a thickening in the wall of the rectum that's up dorsally, for instance, and you're not certain if it's actually within the wall or if it's a luminal, it's a polyp sticking down. Polyps you can move back and forth. Mural structures will slide back and forth, and extramural structures like the sacral lymph node, for instance, are tethered dorsally. They're tethered to the sacrum. So if this was the node, you can only slide it so far laterally before it snaps back, and then you slide it the other direction and it snaps back. So it stays generally in the same location, whereas if it was actually in the wall of the rectum, you can move the whole thing over as you slide your fingers back and forth. So you can tell at what depth you are by the way that the structure moves. The normal sacral lymph node is not palpable. You can't feel it in a normal animal. If they're very large, it's a series of masses on the underside of the sacrum, and it's not hard to discern. As you're sliding your finger in on the ventral aspect of the sacrum, there's bumps in the way, and you can feel those. You can feel those masses pushing down and occupying a portion of the pelvic canal. When it's only a little bit enlarged, like for instance, a dog with an anal sac adenocarcinoma with early metastasis to the sacral node, then it's actually they tend to be a little bit oblong, so they're oriented sagittally, and again they're tethered to the sacrum, so you slide it to the limits of its mobility, it snaps back, and do it the other way. Where that sacral lymph node sits in a cranial to caudal direction is sort of just in front of where the muscles from the tail insert on the ventral aspect of the sacrum. And so if you're not certain what I mean by those muscles, the next time you do a rectal exam, pull your finger out almost all the way out of the anus with the soft part of your finger pointed upwards, and slide your fingers laterally until you come across that muscle. And then you can do the same thing on the other side if your fingers if your hands are flexible enough. And you follow that muscle all the way to its point of insertion on the ventral aspect of the sacrum. and it gets thinner and thinner as it goes. It goes to a thin aponeurosis on the at the insertion on the ventral aspect of the sacrum, so basically you can't feel it anymore when it gets to that point. Just in front of that point is where the sacral lymph node would sit if it were palpable. So when they're slightly enlarged, that's where you're looking. And so knowing the anatomy of the tail, the muscles, and the bones of the pelvic canal is helpful for you to visually or mentally create a picture of what you're feeling with your fingers as you're doing it. So you're gonna be gentle as you go through, fatigue the muscles, go all the way ventrally so you don't get feces on your finger. You're going to go all the way around the full circumference in both directions, feeling superficially for mucosal abnormalities, pushing a little harder for those structures that are extramural. Other than the sacrum, sacral lymph node, the other extramural structures would be the bones of the pelvic canal, so the ileum on each side. And so you're going to feel those bony structures for any asymmetries or structural abnormalities. So you've done the full circumference in both directions, superficially and with a deeper palpation. And then before you're done, as you're about to come out, then you want to palpate the anal sacs on each side. And so the anal sacs sit at 4 and 8 o'clock with the orifice being at the same level on the edge of the anus. And my recommendation is that on animals that are over 5 years of age, that they should have their anal sacs completely expressed a couple times a year to try and identify tumors when they're small. If you've got an anal sac and there's a tumor sticking out of the external surface of the sac, then as you slide you have your finger in the rectum, as you slide your finger over it, you can feel a little irregularity, and you might be able to determine that there's a tumor even though the sac is full. However, if the tumor is actually within the wall or in the lumen, sticking into the lumen of the anal sac, you can't actually palpate that unless you've emptied the sac completely. So you need to express the anal sac to empty it and compare the side to each other in order to feel those small tumors. And unfortunately, we find them way too late, because people don't routinely express the anal sacs and palpate for those. And so early detection is a good way to improve outcome for dogs with anal sac tumors. And so you need to express them completely in order to be able to feel that. Expressing them completely is not always easy. So to do so, you want to try and keep your fingers oriented. If the animal were pointing this direction, your finger is going to be in the anus, and your thumb's along the lateral aspect of the anus. I'll use my right hand, even though I'm left-handed. And you're going to try and center the anal sac between your thumb and your forefinger. If you push hard, it hurts. And so you want to start slowly and gradually compress the anal sac. And you want to try and keep your fingers centered on the sac such that it doesn't slip between your fingers. If it slips out between your fingers, particularly a problem in younger animals, that's really uncomfortable for the animal, and they react very negatively to that. And so if it feels like it's starting to slip, let up the pressure, re-center your fingers, and then start the pressure again. And go slowly to try and get the flow going. One of the tendencies is that if this is the anus, is to pull the sac towards the anus. And when you do that, you effectively kink the neck of the anal sac and make it harder to express that material. So you're pressing on the sac and kinking the neck at the same time, which just increases the pressure in the sac and hurts the dog. And so, if anything, you're going to orient your fingers pressing in a cranial to caudal direction, and if anything, move the sac laterally to try and stretch out that neck so that it's easier for the flow to start. And so go slowly, try not to pull it towards the anus, express in a cranial to caudal direction, and once you've got your fingers touching each other, you've expressed as much with that, you need to let go and let the sac round up again to become a ball again, and then express the remainder of the material. It typically takes a couple of squeezes in order to be able to empty the sacs. You want to do that on both sides.